Is this one swollen?
No.
No, this one was a good knee.
Yeah, I'm trying to keep it that way. I've been using the one I paid all that money for.
Yeah.
Good. How are you?
Good. What's going on? So how far are we?
December the 15th will be 4 months.
Almost 4 months?
Yeah. But the thing is, you know, sometimes Dr. Perez, it gets warm to the touch.
It can be warm to the touch because still there's blood flow going towards the knee. And it stays warm for a little bit. What we're concerned when it's warm is if it's warm and red.
Okay.
Start having any drainage through the skin.
Oh.
Okay. Or swollen. That's when we're a little bit more concerned. Bend the knee all the way back. Good. Stretch it out. Stretch it out. All right. From here. Okay. Stand up from the chair. Okay. Take a couple steps. Show the. Come back. Pretty good.
It's just and I read it's gonna take like a whole year for it to heal.
3 months with the amount of range of motion and activity that you do now, we can clear you to full activity. 6 months is when it takes time to master going up and down stairs. Typically for walking, doing normal activities, 3 months. Right now, are you still in therapy?
Let me tell you what they did. So
tell them what they did.
They have in-house therapy when you're in the hospital. So they came and did a couple of therapeutic things, exercises for me. So when I got out of the hospital, I called up. They say you have to get a release from the doctor. So Lori called and got the release. They told me they couldn't put me until November the 20th.
Okay.
I was like, well, you know what? I tell you what, I've been going through a lot of things. So if I gotta wait a whole month, then.
So you did therapy by yourself, basically?
I have a real nice machine that's got arms and feet, and you sit on it.
So that tells you that knee replacement, and I've heard this from some surgeons. Some surgeons don't even send patients for physical therapy because they think that the constant pushing and pulling, it only aggravates the pain that the patient had from the surgery. This is anecdotal. I do send patients to physical therapy, all of them, at least for 3 months. There are some surgeons that say, hey, we just give them home exercise program. Eventually, once the knee swelling goes down, motion comes back, they are more comfortable because they're not fighting with the physical therapy and that constant irritation. This is proof, although this is not what we intended, but she basically did very light physical therapy exercises on her own. And now she's able to stand up from a chair, ambulate, going up and down stairs. There's still some adjustments that need to be done because your quad muscle doesn't completely fires up until 6 months. But what we're looking for at this stage is that the incision is looking good, range of motion is good, and then she's able to perform her activities of daily living. After the 3-month mark, if patients are like her, then I just tell them you don't have to come back unless you have any other problem. So you have an idea of her condition. I've seen her for the last, you've been my patient for like 2 years or so.
Yeah.
And she came with the knee swollen. We drained the fluid multiple times. We put cortisone injection, and it will come in cycles. Did well for a few months, and then she had to come back in. We did an MRI. They showed some wear and tear, meniscal tears. So I did an arthroscopic procedure on her to just clean the whole knee joint. She got a little bit better for a while, but then the swelling came back and we had to do the same thing. Aspirate, put cortisone shots. We did the trial of the gel injections as well. Nothing helped. In a span of 2 years, I repeated the x-rays. In that time frame, her knee became a bone-on-bone knee. That's when we decided, well, nothing else has worked. We need to do the knee replacement. And it's 3 months after the knee replacement, there's no more swelling. Swelling is fluid in the knee joint. There's still some engorgement of the tissue. That's just scarring, which will go down over the first year. But the swelling, the fluid that the patient had before, that's gone. Is this one swollen?
No.
No, this one was a good knee.
Yeah, I'm trying to keep it that way. I've been using the one I paid all that money for.
Yeah.
Same.
Bueno, sí.